The letter from the Centers of Medicare and Medicaid Services cites the Guam Memorial Hospital for failing to meet the following one condition of participation in the Medicare program: physical environment. And the letter goes on to state that the physical environment deficiencies are of such a character to pose immediate jeopardy to the health or safety of the agency's patients.
They are referring to in the event that there is a fire. The door locking mechanism has to be meeting the National Fire Protection Code. And this is where they're citing us under the physical environment.
Again, you're not being cited for the medical care of the patients.
No, we're not.
But the full report on CMS's May 27th survey of GMH paints a picture of more widespread problems beyond physical environmental deficiencies. The full report cites the hospital for failing to meet the standards in a number of areas, including failure to examine the credentials of medical staff, failure to meet standards in the administration of drugs, lack of patient privacy, expired medical devices and medications, failure to ensure confidentiality of medical records, and more. Echoes of testimony Dr. Sam Friedman gave before the legislature a few months back.
I was telling it like it is. If you don't want to believe it, that's fine. And it seems like the senators want to keep saying the emperor has a wonderful suit of clothing instead of the emperor has no clothes.
This proves it?
Well, this, as far as it goes, proves it. There's certainly a lot more that if one looked deeper would see even more than this, far more than this.
But the CMS letter specifically cited GMH only for failing to meet one condition: the physical environmental requirements. Former GMH board chairman and Bank of Guam president Leon Guerrero agrees.
They didn't cite any medical issues. They didn't cite in the letter. They're not saying we're going to remove the CMS because there are no medical credentialing or there are no medical administration policies. But they did cite that in the deficiencies. And I want to make a comment about that. But the major thing is the physical environment. So
you agree with Ray about that?
I agree. I agree with Ray.
But the turnover in hospital management at the start of this year, she says, has not helped.
You can't help but think you've totally removed people with historical information, people who know the process, people who have gone through the JC, people who have gone through CMS certification, so people that know what to do. Okay, so you have now a brand new group of people, right? So there has to be some learning curve disadvantages here, right? I'm not saying that is the cause of this. I don't know that. But I'm thinking, you can't help but think that maybe this might be, a reflection of it.
And Guam Medical Association President Dr. Tom Shea is also concerned about the report.
This is the first one I've seen from Medicare, Medicaid, the CMS, that I've seen it this severe. I've never seen anything like this where they're going to threaten to take away funding. Medicare, they don't like it. CMS, let me tell you, they want to make sure that you get provided with federal funding. They don't want to take away funding from you because it affects patients. And at the end of the day, I don't think we're going to lose the funding personally. Okay, I think we're going to still retain it. But we need to make sure that we're transparent and we're communicating and working with doctors together.
Dr. Shea's reading of the CMS letter and the full report is that GMH must provide an explanation in the blank right-hand column to every one of the deficiencies cited in the 78-page CMS report.
Why is the patient in pain, for example, and why isn't the adequate pain management being given to that particular patient? They're going to have to explain that.
GMH is going to have to answer every one of those issues on the 78 pages?
I think so. Yeah.
That's going to take a long time.
It will, but they're going to have to do it, and I'm sure they're already working on it. But certainly, whatever they're doing is internal. It's not involving us physicians.
And both Dr. Shea and Leon Guerrero agree that the physical environmental issues as well as the healthcare issues in the full report must be addressed.
This is not the administration's hospital. This is our hospital. This is the only hospital that we have on Guam. This is a public facility.
Could this threaten JACO accreditation?
JACO could come in anytime and resurvey, and if they find that we haven't really improved, yeah, they could take away the accreditation.
Dr. Friedman, too, is supportive of what Acting Administrator Vega and others are trying to do at the hospital.
This is not damning of the hospital as it stands now, but at least the people trying to run the place. It's damning of what happened for the last number of years.
So you support the new administration at the hospital and their efforts?
Absolutely, but their efforts are being stymied.
By the legislature?
By the legislature, by the group of doctors that control the hospital, that other doctors are afraid to speak out, etc.
Kevin Kerrigan, PNC News.